Hi, everyone. I'm Chris Billhart. I'm the Technical Assistance Specialist for the National Alliance for Safe Housing. Welcome to today's webinar. I'm really glad to have you here. As many of you know, the Domestic Violence and Housing Technical Assistance Consortium has been hosting a series of webinars and deep dives to highlight issues around coordinated entry. And this is all as part of our support to communities and local providers doing the work at the intersection of domestic and sexual violence and homelessness and housing. Today's webinar will be spotlighting two communities. I'm very excited to have them here. They're working to meet the housing needs of survivors in their rural areas. It's been my privilege to work with these amazing people as this webinar took shape, and I'm excited to have them here today to share their wisdom with all of you. Before we get started, though, let's make sure that everyone is acquainted with Nash, the National Alliance for Safe Housing. We are a project of the District Alliance for Safe Housing, DASH, in Washington, D.C., and it's a local safe housing program with many innovative services and practices and programs. We've been a national technical assistance and training provider since October of 2015, so almost 3 years now. We have project partners who are just amazing in pushing our work forward. The Washington State Coalition Against Domestic Violence, who I know many of you are familiar with. They've done lots of work with Domestic Violence Housing First. And the DC Coalition Against Domestic Violence, who is also just a wonderful partner and very skilled in many of the issues that we work on together. And we are part of the Federal Domestic Violence and Housing TA Consortium, DVHTAC, or the consortium, which is much easier. This is an unprecedented coming together of 4 national technical assistance partners, along with 4 federal funding partners. So it's just been a wonderful way for us to combine forces and collaborate in the work that we're doing. And Nash's main mission is to help communities and programs with the tools and support that they need to really increase safe housing options for domestic and sexual violence survivors, so that they can really avoid homelessness as maybe the only means of living free from abuse. So that's what we're all about in a nutshell, and this webinar is part of that work that we do. So first we are going to hear from Taos, New Mexico. Our presenters will tell us about their parallel domestic violence coordinated entry system, which they developed in a large rural area that is very culturally rich, but also has very high rates of poverty, child homelessness, and racial disparities. Following our friends from Taos will be our presenters from Pennsylvania, who will discuss the housing situation in their large state, which has several urban centers, as well as large expanses of very sparsely populated rural areas. They'll also share about their parallel domestic violence coordinated entry system that's been implemented in Lackawanna County, and also share some with us about the programmatic modifications that's being made by the Women's Resource Center in Scranton PA that are aimed at better connecting with survivors in one of the state's large rural areas. I'm going to introduce each group as they step up to the mic. Following their presentations, we'll have time for your questions, so feel free to be typing them into the chat box as we go along, and we'll carry them into the Q&A towards the end of today's time. So on to the heart of the webinar. I'd like to introduce the folks from New Mexico who will be presenting today. From Communities Against Violence in Taos, New Mexico, we'll hear from Rachel Cox, who is the clinical director, and Melinda Williams, the executive director of CAV. And they'll be joined by Hank Hughes, who's the executive director of the New Mexico Coalition to End Homelessness. So Taos, take it away.
Hi, Chris. Thanks so much for that introduction, and hi, everyone around the country. Good morning or afternoon, I guess, depending on where you are. My name is Rachel Cox. Like Chris said, I'm the clinical director here at Community Against Violence. I've been doing this work working with people who have experienced trauma and also people who have experienced housing instability or homelessness for about the past 18 years, both out back east in New England and then here in New Mexico.
I'm Melinda Williams, and thank you everyone for setting aside time to talk with us today, and we are happy to be able to present what we're doing here. We know it won't work everywhere and doesn't necessarily fit everyone's population, but I've been really curious how everyone else does it, and I've enjoyed these workshops, and so we appreciate the time. I've been working with the populations in northern New Mexico and with the Homeless Coalition for almost 25 years now, and we've learned a lot over that time, what works and doesn't.
I'm realizing our voices kind of sound similar, and so we'll just kind of try to speak up about who we are. Melinda's role is she's the executive director and has a lot of the history, again, because she's been doing this work for so long, but we'll also try to identify sort of who we are as we talk, and I think you'll be able to hear Hank's voice also.
Yeah, mine's a little different.
So a brief outline of what we'll be looking at is a little bit about who we are as organizations, the history of the COC here in New Mexico, a bit of the context for services, who we're serving and what the communities look like where these services are being provided, and then what coordinated entry looks like currently, and understanding that that's kind of still a bit of a process in our state as we identify the best tools and ways of collaborating in that process. So just a little bit about Community Against Violence. So Taos is located about an hour and a half north of Santa Fe in north central New Mexico. We serve survivors of domestic sexual violence and child abuse. All of our services are for all survivors, so that's male, female, and transgender clients. We have beginnings very similar to a lot of domestic violence and rape crisis agencies back in the late 70s. We were started in 1978 by a group of very fierce volunteers who were responding to a number of homicides in our community that were related to domestic violence, which I feel like, you know, again, as many of us are celebrating near 40 years, those 4 mothers and 4 partners that were there, those roots are really being celebrated now, which is exciting. And so we had those grassroots beginnings, and we really are trying to hold on to that way of working with people currently in terms of merging what might be federal or state guidelines with really what the needs of our communities are. So I would say all of the programs that you see in front of you on the screen really were developed slowly, sustainably, and over time, blending federal and state guidelines with community-level needs. So our emergency shelter and transitional housing program is all on site here, and again, that's available to all survivors of sexual and domestic violence and child abuse. And the emergency shelter is available for up to 90 days. That's a funding limitation. And then we have what we call a phased system in terms of how we structure our transitional housing program here that allows survivors, if needed, to stay in on-site transitional housing units. A wide variety of needs can kind of play into that. If people have legal remedies that still need to be sought out, if they're identifying employment opportunities and child care, all of those kinds of things, which in our community sometimes takes longer than 90 days, then they can stay on site while they are able to come up with all of those solutions and resources. And then they can transition to a scattered site lease model in the community in their own home. And they can also just directly transition from emergency shelter to scattered site, or they can just transition from their own home to those scattered sites also. We really are trying to, in that program design, make sure that it is a program design that is available to anybody at any point and doesn't necessarily only serve people with certain resources as they're coming to the program, and want to make sure that people might be able to develop those while they're in shelter here and not necessarily be screened out of resources for those reasons. So those housing programs are supported by advocacy and counseling, parenting, and the financial empowerment program that we have. We have some all-state funds, which has been a really fantastic addition to our housing programming that supports clients with a dollar-for-dollar match savings program when they've participated in a brief curriculum. And that's been wonderful because people have been able to make down payments on homes, pay off big debt, those kinds of things. And a wonderful component also of our whole agency is our thrift store, where all the proceeds from that help support support our large budget at this point. We have about a $2.8 million budget for our services. That's a little bit about who we are. Hank, the next slide is there kind of talking a little bit about the coalition, so I'm going to pass it off to you.
All right, that sounds good. So the Coalition to End Homelessness was in New Mexico, was founded in the year 2000. It's always involved domestic violence programs as part of our membership. Community Against Violence was one of the founding members, and Melinda and I were both actually there at the beginning of the coalition. We have about 70 members across the state now. Originally, we were founded, primarily to deal with the Continuum of Care application and also partly to lobby our state legislature. We still do both of those things. We manage the Continuum of Care HUD grant assistance program for the state, but we've also added on the Homeless Management Information System, which many of you know is a required data system. And part of the fun of doing HMIS was figuring out how to get a comparable database for our domestic violence providers. We're still working through that, but we're making progress there. And then in 2014, when HUD started talking about coordinated assessment and coordinated entry, we thought that it sounded like a really good idea given the large geographic distances in our state, the fact that, we weren't serving everybody and yet we had empty beds in some communities sometimes. And so we were really excited about jumping on that. So we've had coordinated entry since 2014. Some of the other things we do, we have a VISTA program where we place VISTA volunteers at some of our member agencies to help build their capacity. And of course, part of our job is to do education about homelessness so that people have the right idea and the right idea about the solutions. And I think the next slide, why don't we go to the next slide, just a little bit about the Continuum of Care. I don't know if everybody knows what that is, but it's basically HUD's name for its grants for housing programs for homeless people. It's the largest amount of federal money that addresses homelessness, and so it's very important, I think, in almost every state, certainly in ours. And so we have always wanted to make sure that this money was spread around fairly, trying to reach out to rural communities so that there is some housing for homeless people in rural communities. I believe that Community Against Violence actually had one of the very first Continuum of Care grants in New Mexico, and the grant was originally to help them build their shelter, but it has since evolved into the program that Rachel described, where it's a little bit of transitional housing within the shelter and then scattered site outside the shelter. So we manage about, a total of $10 million through the Continuum of Care every year. And I like to think that, part of our job as the coalition is to help our member agencies use that money in a way that keeps them in line with what HUD is expecting. And then I think we can move to the next slide.
Thank you, Hank. So this is Rachel again. We've been listening in on a number of these webinars and also benefit so often from all different kinds of resources in terms of survivor services or other housing solutions that other communities and states have found. And so we know that all around the country, those solutions look really different. And I guess sort of what we wanted to just make sure and ground our presentation in today is that while we've really benefited from ideas that were really so far off our radar, oh my gosh, that's such a fantastic solution and we brought it here and it really transformed services, there's other times where we've brought stuff in and we're like, wait, why is this not working as wildly as it did, in this other place when we've come back from a training or something like that. And so we really recognize that it's because the context of that place has key elements that maybe ours doesn't. If it's the right people or the right place or the right time, that these elements can really impact program implementation. So we just want to encourage everybody today to take pieces of what we're talking about, kind of like what Melinda was saying in the beginning, take the pieces that might work for your community, and then also kind of try to understand the context in terms of why certain things that might be in a more urban or a more like population dense environment sometimes don't always translate to rural models. And again, we can always all benefit. I feel like there's a Venn diagram sort of where we all overlap, and then there's pieces where it's really important for people to be able to tailor their programs in a way that really meet the unique needs around the community. And everybody listening knows exactly what that is because you're all in it. But I did want to, we did just kind of want to really make clear the context of the services being provided. And so in saying that, we at CAV are definitely a strengths-based organization, so it feels weird to kind of focus intensely on the negative components for a moment. But the context for New Mexico, looking at this map, is that we are on the top or the bottom of lots of lists that are very challenging to be at the top or bottom of. And so we are a very large geographic state. We have a lot of space, but we don't have a lot of population density, and so there's small communities with a lot of space in between a lot of them. We really just have Santa Fe and Albuquerque, and at the very bottom of the state, Las Cruces, are really these larger urban centers with a lot of miles in between them. I've seen maps before where, you know, about a third of New England fits inside of New Mexico, and so again, that's just trying to kind of highlight a little bit of the context of how we provide services. So we currently rank very high in terms of child homelessness. One of the things that I like about how they've looked at the statistics on this slide is that it's really, it's not just sort of the number of children experiencing homelessness, it's also including the sort of complex and exponential intensity of that, because it's also including the rates impacted by like high poverty rates, the lack of affordable housing, racial disparity, and the impact of trauma, domestic violence, and single parenting, which all of that really rings true for us in northern New Mexico, that we have high rates of child homelessness, and then we also have very high rates of these other experiences for people. We've typically ranked very low in the quality of education, 49th in the state. I'm going to click kind of quickly through these. We also have very high rates of child abuse, one of the highest rates of children dying from abuse in the country. We also have generally high crime rates. What's not on here is we also experience very high rates of opioid use, and also very low, we don't have a lot of access to services for that addiction. And so again, not to minimize that it's hard working with these kinds of struggles across different states and different communities, but I think it's important to kind of think about, you know, especially from a funding perspective, you know, if people, you know, if they're looking at creating mandates around different kinds of programming and implementation, you know, to consider what is it like for states that might be more resource scarce, have a lot of just rural components to it, a lot of trauma. What does that really mean for the people accessing services, and to recognize that it is different than areas that have you know, more access to those resources, et cetera. And I guess, again, because we are so strengths-based, it gets uncomfortable for me to focus on these negative pieces, because we really believe in the resiliency of people in the face of all kinds of life experiences. But again, in the context of providing services, sometimes it can be helpful to take some of these key elements into consideration in terms of, do we want to just implement a program that's been mandated, or do we also want to be able to blend that with what's really going to work for the people in our community? And we have to understand those needs. And so the unique needs of our communities involve a lot of what's on these lists. And it also involves, so for us, you know, again, I'm not from this community, but we have this conversation a lot here with people, or with my coworkers who have grown up and lived here. What can be true for a lot of people who grow up here in terms of the norms and values of beliefs around housing. Two things really impact that for us in terms of the provision of homelessness programming. One is that typically, to be gender specific for a moment, women are not typically raised with the value of being head of household. or living independently outside away from the family structure. Typically people live in kind of large family compounds or live very near each other. And so what that can look like then is that sometimes interventions can be sort of more focused on a skills-based intervention, like the idea that someone needs to learn how to manage a checking account or these kinds of things. But where we find ourselves sometimes also is exploring people's values with them, because we find if we take someone that doesn't quite, or that might need support with holding the value of being sort of housed independently away from some of those family structures that, and put them in a home, if they're not able to really sort of envision themselves in that way, it can really be a setup. So a lot of our programming really focuses on exploring what are people's beliefs and values about how they are wanting and choosing to live their lives. And kind of what Hank was saying, something that comes up for us is, you know, we have, again, maybe empty beds around the state that coordinated entry might be able to help with. One of the things that come up, again, in terms of values and beliefs for the families that we tend to work with is not necessarily a sense, I guess, to put it this way, of mobility in terms of solving those problems. And so the idea that people are raised, most people kind of tend to think of life beginning and living and ending in Taos, in their community, and I think that's true in a number of other communities in New Mexico. And so relocating is not always necessarily an option for people as a solution for their homelessness. I guess a couple other things I want to say about our community is that we do lack other helping organizations. CAV is really one of the primary organizations in the community. We also are not able, so many other communities are able to rely on hotel voucher systems either for overflow for emergency shelter or to sometimes even maybe replace an emergency shelter structure. Or they also use it as, you know, as part of their transitional housing program. For us, what happened is 3 or 4 years ago, there was another housing organization that was really trying to help difficult to serve people and people who were experiencing chronic homelessness that weren't able to find beds either at CAV or needed them here in Taos. And in doing that, the relationship between nonprofits and hotels really struggled. And so we have at this point hotels not willing to partner with other nonprofits around housing for people. And frequently throughout the year, because we are a pretty big tourist destination because of a ski valley that we have here, hotels will be screening people for local addresses and not be giving rooms to people who have a local residence listed on their ID. And so even though we're really trying, at this point, I would say we're trying to get that system back up and running and trying to nurture some of those partners, the hotels are really resistant from that previous experience that they had with serving people. I guess one other thing I want to say about the people that we're working with, again, this would be people who would be overrepresented in our services. I think, you know, we work with people, especially survivors of domestic and sexual violence, from all over the community, from different socioeconomic statuses, education levels, job status, all kinds of things like that. So we know that those are experiences, including homelessness, that can really happen to anybody. But again, people who are overrepresented in our system are people who are impacted by intergenerational trauma, and with that might be experiencing mental health or substance abuse related to that trauma. And so lots of modalities, therapeutic or housing interventions, sometimes really focus on the idea of we're going to kind of get you back to where you were. You know, life became challenging at some point, but it was mostly good before that, and we're going to restore that sense of safety and hope that you might have in the world through programming and through relationship. Who we tend to see overrepresented in our services can really be people who might be experiencing that sense of hope or safety for the very first time because of those kind of chronic traumatic experiences in their life. And that takes a long time, and that takes being patient with people, and it takes really listening to what their needs are and meeting them where they're at. Yeah, there's so much to say about all of those things. I think I will pass it over to Melinda to talk a little bit again in her many decades of experience with us about the relational history between domestic violence and homeless organizations in the state.
Right. I'm going to take you day by day through CAV's 40-year history. Now, like Hank alluded to, one of the huge benefits that we've been able to have is that our agency was around at the beginning of the Homeless Coalition for the state. As such, so we received our first HUD funding in 1995. I think we were one of 16 that were awarded in the whole nation. And it was set up very much different than what is funded today and what's allowed today. But one of the things that came from it is that even though we opened the shelter that at that time housed both emergency shelter and transitional housing, and which was allowable from HUD at that point, is that when we opened it in 97, even though VAWA had been passed already, back in 1994, I believe it was, none of us had any idea really what that meant to us so far as protections for confidentiality and the safety of victims. And we were still all operating for quite a number of years on the well, there are funders and, they're going to protect this information. They're not going to go out and tell everybody what happened to, this woman or this man's story. So when they would come on site and do a site visit, the HUD grant managers, they would review all of the files in their entirety, and they would also interview the survivors who were in the programs. And again, none of us realized that that was an issue, but gradually started understanding, oh wow, VAWA is doing exactly what we asked them to do a long time ago, and we aren't supposed to just assume that we're all going to keep everything confidential, because it's not our information to make those assumptions with. And so eventually we all got on our domestic violence coalitions, and service providers got on the same page, and National helped with that, but of how we needed to protect people's information. And that meant that we couldn't just hand over information to HUD that was identifying information, and therefore we couldn't just, any of our other sort of collaborators, which the Homeless Coalition truly was, couldn't just have that information either. And so with that sort of evolution came, take a step back. Back before the Homeless Coalition came into existence, we were part of this whole political shenanigans based on the federal changes in HUD funding about how each entity needed to do their regional applications instead of individual renewal applications for the HUD funding. And our agency was kicked out of funding because we didn't have a big political base. At that time, I believe Hank was still a provider who was, I think, an agency director at that point for a homeless program. And we really said, I don't know what's going on with HUD, but we're not going to ever not be at the table wherever there's a conversation about HUD funding again. And that funding was eventually reinstated because it had nothing to do with people's performance or any quality of services. It was simply a political thing. But when Hank was hired and the coalition really was formed, and then Hank was hired, is that we really pled with our domestic violence coalition to always have a seat at the table, even if it meant individual agencies taking the lead. And Hank was very encouraging of that and wanted to make sure he promoted the understanding among all of the homeless survivors who were all fighting for funding, to make sure we were looking at not only domestic violence, but sexual violence, youth serving agencies, but a way so that we could each understand what the other people needed, what their clients needed, what their programs needed, and what were the abilities and limitations of the HUD funding available. And so it went from even in, I think, Hank, you're the one who promoted us to do this, is the National Coalition to End Homelessness did a forum that was about the crossover of homelessness and domestic violence. And it was in St. Louis back in 2002. But they flew us out there to talk about it because apparently at that point in the nation, hardly any of the homeless coalitions in all the states had any domestic violence representation on it. And so there was this real, hey, what's going on out there in New Mexico? You all seem to be not only talking to each other, but able to navigate some really hard conversations. And I have to say that the relationship approach that we're used to in our neck of the woods lends itself to that. And Hank and his whole, inherently who he is and who he is fostering the coalition to be, is that we're in it together. And even if it means we have to take funding hits occasionally, or we all have to get together and call all our congressional delegates and ask for a meeting to talk about what's not working at HUD, that he's willing to help us do the pushback. When HUD started making whatever ruling it was at that point in time, because there's been several over these few decades, is that when they would make a rule saying everyone needs to enter all their information into a database, and it needs to be a homeless information database, we would talk about it ahead of time. And from the Domestic Violence Coalition's perspective and the New Mexico Coalition on Homelessness is that we start having these conversations informally and then say, let's put together a work group. And the reason is that we really needed there not to be the solution that was created without survivors' voices, that needed to not have the confidentiality and the protection and the safety as number one in whatever we agreed to do. And that did involve quite a bit of some really tense conversations, because as our agency expanded, as the Homeless Coalition's role expanded, they would hire new people, and Hank would put in charge, the new IT person to be in charge of putting together a database or finding the right database that would meet our needs. And then he would say, okay, so how's this work for everybody? And we would raise our hands and say, that doesn't work for us at all. It's not compliant with VAWA, and it certainly makes us very uncomfortable to even think about how to do it. And we know we have to do something, but let's talk about how to do it. And so, Hank, I'm thinking especially of this meeting that we held in Esperanza, where domestic violence providers from around the state came and met with you, and I think it was Roman, the IT person, to talk about how are we going to come up with what we need. And fortunately for New Mexico, Hank was willing to talk to the national network, and I think Cindy Southworth, about what protections were needed to be in a database in order to meet the needs of survivors, which are ultimately in VAWA, laws protections. And so from that, we just kept being at the table, even through some really, really difficult, challenging conversations, with a commitment that even if we don't agree, even if we're left with some really tense feelings, that we're going to stay at the table and we're going to continue working it out and hold that as our core needs. And I think one of the things that our state has done that has been helpful along this process is that people are committed to staying on committees. So if the Homeless Coalition put together, like we have a Balance of State board who looks over the Continuum of Care, when it's coming out, what rules do we have to put in place, we have to make sure that there's somebody who's representative of the youth serving organizations, of the domestic violence program agencies, and general homelessness and veterans and all that. But so it's not just that particular group, but there were stuff like when you're putting together a conference, the state homeless conferences, is that you try and have panels from each of the different entities so that we can influence all of the conversations, that they keep considering what do DV programs need, what do sexual assault programs need. And I think that has really helped us frame what has continued to be a work through what HUD demands and what we can give them and be in compliance while still protecting our providers. One more example on that is that the last conference call that we had for one of the committees that we've stayed at the table on, it kind of, I don't even know if this was my thing, but we threw out that some of the new rules from HUD start, like you have to cut this funding from this program because it's low performing. You have to cut, funding from this type of program because it's low performing, and then because we lose, I hope this makes sense, we lose points in the scoring for HUD applications for our state if we don't all have these specific outcomes. But when you dig down deep, what is happening is that we're ending up in this Hunger Games sort of mentality of the funds for HUD, and it's being created by what's happening at a federal level without being informed on the reality of the populations that we serve. And so some of what happens in the committee meetings, all of the various committees, is that all of us have the responsibility then and the obligation to keep bringing up, okay, I understand we have to increase people's, let's say, their income over the time that they're within our transitional housing program. But if they're starting from a place of generations of trauma and the effects of trauma, and like for example, CAV is the only only HUD program here in New Mexico, in northern New Mexico, then we have to make sure that we're not turning away people who need the programs, and that might mean that we're going to end up scoring low on that particular item for a few families, and the coalition's been able to be at the table with us. All right, I've said plenty. Thank you very much.
Hank, what would you add in terms of the coalition's perspective and remembering those conversations? Because you were very patient with us in terms of our feedback, specifically around coordinated entry and the adoption of the VI SPDAT. And so I'm wondering what you remember about what the coalition needed to learn, or how maybe DV programs said it in a way that you were able to understand or hear in terms of understanding VAWA and our other federal guidelines, not just the HUD guidelines, but the VAWA ones as well.
Well, I think that, that the key was that we were all getting together and talking things through. And we already sort of, as we approached, especially when we approached coordinated entry, we already had the experience of working through the comparable database. But I think it was helpful that, on our end at the coalition, we had read all the HUD regulations and we sort of knew what HUD was expecting. And you all on the DV side had read all the VAWA regulations, so you know what was required from that end. And I think when we started making progress was when we started figuring out what can we do that meets all these different requirements and trying to fit something in, which wasn't what we had envisioned originally because we didn't know about VAWA. And it probably wasn't what you envisioned originally because you didn't know all the HUD regulations. So it was really, putting our heads together, I think, and being willing to listen to each other about how to make a system that would work. And I think we're still working on that system. So when we get to it in a minute, it's a work in progress.
Thank you. So what does the parallel coordinated entry look like in New Mexico? So currently, agencies are using the VI SPDAT. Although that's the piece also that really is, I think, in process right now for a couple of different reasons that we'll talk about in terms of how that tool has worked and been implemented so far in New Mexico. So the way DV agencies are doing it here, when someone could benefit from housing services, the provider completes the VI SPDAT with the client. Typically at this point, because of the scarcity of homeless organizations in most communities, DV agencies frequently will have a transitional housing or a rapid rehousing program that they refer to in-house because there's really no one else in the community to coordinate with. So we're seeing right now that the VI SPDAT is completed and kept on file if that person is going to be accessing other housing services within the DV agency. But if the participant chooses to relocate either to another community or is looking, or if that community happens to have other housing resources in it, there's a couple of ways that happens. So if they wanted to relocate to another community, we would simply just have the survivor sign a release of information, and then we would share that VI SPDAT with the New Mexico Coalition to End Homelessness to be entered into the statewide coordinated entry system. And if the participant chooses to relocate, they could also be housed by another DV housing agency. And again, with the release of information, the VI SPDAT would be shared with that DV agency. So in terms of still being in process, what we're finding is working about this way of doing it right now is that it's a good balance, kind of like what Hank was saying. It's a balance between federal HUD guidelines and the VAWA confidentiality laws and regulations that DV agencies are required to meet simultaneously. And the process does not overwhelm participants and allows them to access needed housing. And so the tool is not high barrier at all. I mean, in a lot of ways, when we're doing it with survivors, those are questions that are helpful to be talking about anyways and those kinds of things. So it's not creating an additional barrier, which is what we're always looking to make sure that we're decreasing. And it also allows for, if the participant wishes to relocate, for a seamless entry into the homeless system and for us to coordinate with the other side of the parallel entry system with homeless providers.
One thing I think is...
What our ongoing conversations right now are specifically really around the VI SPDAT tool. For us, specifically at CAV, around 75% of people score high enough to qualify for permanent supportive housing. And in saying that, not necessarily because of like the past year of chronicity, but really because of all the other extenuating factors that are there for them. So sometimes it can be challenging to really sort through with really high need who is really the best, or who should qualify for services, because so many people ranking higher at that same number, such high need. The other piece of it, on the other hand, is that we're also hearing from around the state that sometimes, because the VI-SPDAT relies so heavily on self-reporting from survivors and clients, that sometimes people might feel like, even if they've been really, even if the use of it's really transparent, they might feel like if some of those questions, if answered honestly, maybe they'd be screened out of housing. So sometimes people are also scoring really low when they really actually would qualify for a much, something more like permanent supportive housing and things like that. Hank, would you add anything else to how you've seen the implementation of the VI-SPDAT around the state?
Yeah, well, I think well, one thing I wanted to make sure we highlight is that if people are going to be entered into the statewide coordinated entry system, which is housed in our HMIS database, which is obviously online, that we do have a way that people can do it anonymously. And especially if they're like staying at a domestic violence shelter, that's what we want them to do. I think that one of the things we need to work on, I've noticed that I don't think everybody always takes advantage of that anonymous feature. And so that's one of the things I think we're going to work on improving about our system, is making sure that the domestic violence agencies know that they can help someone enter themselves anonymously into the system, so that none of their information is shared, even among the very small community of people who have access to our HMIS. I think the other thing to add is that I don't know if everybody on the call knows what the VI-SPDAT is, but it's basically a 4-page questionnaire that asks about your health, mental health, whether you've been a victim of domestic violence, other risk factors that you have for not being housed, and gives you a score in terms of how high a priority you should be for housing. And of course, we do have way more people score high in their need for housing than we have housing available, which is a disadvantage of our system. We just need more housing, perhaps. I think the advantage of the VI-SPDAT over not using any kind of assessment tool is that at least we have an idea of who the really, really high need people are, so that we're not overlooking them. I think that what we were finding before is that lots of times the people who are the most vulnerable and the most needy are not the best advocates for themselves for getting services, and so they might get overlooked in terms of serving someone who's a little bit easier to serve or more vocal about their need for housing. The thing we're looking at is that, of course, the VI-SPDAT, as Rachel mentioned, isn't always accurate, and it actually was not designed to be used quite as heavily as we rely on it. We just don't have anything better, but we are kind of evaluating either whether we want to use a different assessment tool or whether we want to sort of change the way we use the VI-SPDAT so that we're taking into account its weaknesses as we go forward.
Thank you. And so I guess just in closing, one of the things, the coordinated entry, again, exactly like what Hank said, when that principle came through, I think we can all relate to the idea of a more coordinated system, right? We don't want people in communities siloed, and we don't want people not being able to benefit from something because simply we are not coordinated. So I think we really emphasize and prioritize the idea of working towards coordination, and then also are working again in the context of the services that are being provided, balancing federal need, balancing local, statewide need, those kinds of things. And so I think it's also for anybody who is serving really rural clients with HUD funding, it can be helpful to think about, how do I stay compliant with this? How do I make sure that also that clients are benefiting from this coordinated process, and how that will just look so different than more, again, densely populated or urban centers. We really appreciate everybody's time. Chris, I think that's it for us.
All right, great. Thank you so much, Rachel and Melinda and Hank. And I know we're really open to questions that folks may have for the New Mexico folks, and we're going to be now moving into hearing more about Pennsylvania. So Jennifer Thompson, who is the Victim Services Manager at the Pennsylvania Coalition Against Domestic Violence, will first help by providing a statewide picture, and then she will be followed by Carol Schoner, who is the Economic Advocacy Director for the Women's Resource Center in Scranton, PA. Jennifer, I think you're going first, so I'll turn it over to you.
Thank you very much. We're excited to be here and to talk about Pennsylvania a little bit. So I will start with just a little overview of the coalition and kind of our program statewide and what the state looks like. And then I will move in to talk about the history of housing. I don't quite have the 25 years of experience that Melinda has in the history like she has in New Mexico, but I will do my best to provide the history here in Pennsylvania, and then give a little statewide perspective on how housing looks across the state. It's very different across the state here, and then I will turn it over to Carol after that. So let me start with a little bit about the coalition. We are one of the oldest coalitions in the nation. We are celebrating 42 years this year. There are 59 programs across Pennsylvania that serve all 67 of the counties. And to give you perspective, of the 67 counties, 49 are considered rural. So we are a very long state with a couple pockets of very populated cities. Everybody probably knows Pittsburgh and Philadelphia, and there are a couple other large cities, but they are very much surrounded by a lot of rural areas. In those 49 counties, they are served by 38 of our programs. A lot of the rural counties, the programs serve more than one county. And so that's kind of a perspective of what the state looks like as a whole. So for us at PCADV, our housing philosophy is really I think I can advance it. There we go. It's really to work with the programs across the state, the local community domestic violence programs, to increase safety and access to affordable housing. And from our end, we do that through a lot of legislative advocacy. We really are looking at the laws that are being implemented and the laws that are being put out on the floor in the legislature and how those impact housing across the state as well as housing for domestic violence victims. One big area that we focus on is the education. I think a lot of so our housing is kind of over in one sector, and HUD and all the housing dollars through the consortiums are focused over here, and the domestic violence programs are focusing on housing over here, and a lot of times the two aren't connecting or talking, and so we are trying to bridge that gap with some statewide education. And then also by participating in kind of those state-level stakeholder meetings and committees to try to have the voice of domestic violence always at the table. And we provide training and technical assistance to our programs, which I'll talk about a little more in a little bit as to why the need is there for that around housing. So at that macro level to really have the domestic violence voice heard. So our housing across Pennsylvania. So housing here has had many faces. Of course, we started with with emergency shelter and safe houses and moved into the rapid rehousing, which is now coming back. So we went into rapid rehousing for a little while. In the first time this came around, our programs really struggled with it because from the domestic violence standpoint, quickly getting someone into housing without having the basis of some of that economic stability work that goes around it didn't prove successful. And before we could fix that and really work that out, things moved into transitional housing. And so we seemed to quickly move out of rapid rehousing into looking at transitional housing, which has proven to be pretty successful here in Pennsylvania. That left the opportunity to really put those services in place to allow for success. And so now we're really looking at the continuums of care, and with those, in Pennsylvania we have two large consortiums on the two sides of the state. Excuse me. On the western side and the eastern side. And they pretty much serve the whole eastern and whole western side and are two very separate entities. And then everybody else kind of fills in as they can. So there's not a large consortium that brings all of central PA together or all of north central or south central. And so a lot of those communities are left to try to coordinate within their communities or with a few other counties to bring together some type of consortium to get some of these funds funneled through to them. And so what we have seen is in those, from the coalition standpoint, we left it to those local community programs to participate in their continuums of care to get some of the coordinated entry funds. And in doing that, we found that a lot of programs didn't want to participate in those continuums of care. They didn't understand it. They didn't know what the need was and why participate. And so that's where our training and technical assistance came in to try to be that voice to have programs participate in that. Both of the two continuums of care on the two sides of the state were really focused on trying to create a parallel system for domestic violence victims. And so we didn't want them creating that without domestic violence at the table. And so as they participated, we were able to get two parallel systems, but without all programs on board. So in those, on the two sides of the state, we have probably about half of the programs on each side that actually participate in that parallel system. And so we are trying to continue to educate and bring others on board because the voice of the domestic violence programs in that is so important. But through this process, we also found that as a coalition, sitting in as a voice would probably have been beneficial from the beginning, so that there was one solid voice, and then we could provide the education, the resources to all the programs, instead of having kind of scattered conversations. So we have learned some lessons along the way for sure, but as I said, Pennsylvania is kind of different, and in that those two coordinated entry systems are run different, they operate different, the way their funding is resourced out is very different, but domestic violence is at the table in those, but the rest of the state is kind of doing it as they can, and that's what Carol has been doing So the problems that we have found across the state is that difference, and that things seem, they're disjointed. If a person wants to relocate from one place to another, they're going into a different system often that operates different, and so that has been one of the challenges that we have faced. There's also, we have a lot of fracking here as a very rural state, and so the cost of housing is significantly increased, and so being able to have actual affordable housing is very difficult, even with vouchers and other things. It's difficult to find. And so that creates the unequal access across the state. We talked a little bit about how the participation varies across the state with the programs, which also creates a challenge because if you are a program that is not participating in the COC, your access is very different for the survivors that they serve. And so that creates challenges in itself in trying to provide for safe and affordable housing. Collaboration efforts, though, have been very good on the community level with their community resources and trying to work around the challenges in the community. That is one thing that definitely helps those not participating in the coordinated entry is the local collaboration that occurs. Funding, of course, the two COCs on the sides of the state get an astronomical amount of money. Those that just have a smaller community consortium or a couple counties don't see the funding that the larger ones do. So they are able to be a little more well-resourced and find housing options a little easier than some of the others. I am going to turn it over to Carol then in order to talk about how she has been able to work around some of these challenges and really provide housing for the survivors that she serves and what she has done in her community.
Good afternoon, good morning, hello all. Happy to be here. I've been noticing that some of the things that have been said are pretty parallel to some of the things that I have in my PowerPoint and I'm talking about. It's interesting that Taos has some similar things happening in their state, as different as the population in the state is that is happening in Pennsylvania, some of the areas in Pennsylvania. I am going to back this up. Okay. So I also have been doing this work for 30 years, so I've experienced things over time in terms of history as it relates to housing work. The Women's Resource Center was one of the first in the state to be a part of the coalition. It was also created by Simwick Taos, created by a group of determined women to address the social injustices that were happening against them and their children in our community. It was in 1982 that the Women's Resource Center opened a shelter as it is. Our mission is to end domestic and sexual violence through advocacy and education and social change. And our philosophy operates from a feminist analysis. We still use the F word in our work here at the Women's Resource Center of feminist analysis of the violence. Our guiding principles that guide our everyday practice that address safety, confidentiality, respect, survivor-centered advocacy, diversity, holistic assistance, and social change. There is on our website, if you would like to read further about our guiding principles and our philosophical statement, it's there for you to do so. We are a dual program, serving both survivors of sexual assault and domestic violence, and we serve two counties. Susquehanna County is a large geographic area with a population of about 42,000. And then Lackawanna County has 212 of population, with the seat of Scranton at 77,000. For those of you who watched The Office, that might be a point of reference for you in terms of Scranton and where Scranton is and what Scranton's about. We serve an average of 2,000 women, children, significant others, and men per year. You can see on the slide the services that we provide. As it relates to housing, what we have done and are continuing to do over time is to try and create a continuum of choices and to be very flexible in what we're offering. I think we also heard that theme coming from New Mexico today too, and I think there's probably many of you on this call who are experiencing that and know that to also be true as you're doing your housing work. That the more options that you can come up with and provide on that continuum of housing choices, the more chances you are of meeting the variety of needs of survivors that are coming to you. Our budget is around $2,628,000. 43% of that currently is going toward economic and housing work. We have 42 staff, and 6 of those positions are dedicated to doing housing work. So I know that both presenters, Jennifer and those from New Mexico, have also talked about history. I think that there is importance in referencing what has happened in the past. It kind of helps us know where we came from and where we're headed, and hopefully don't make the same mistakes again, or if we do, we can move off of them fairly quickly. But, and I think that most of us have evolved over time also. So back in the 80s and 90s, and I can still remember back in the 80s and 90s, we were serving over 350 women and children for an average of 7 days. So there were very short stays, and basically what women were trying to do with their children at that point in time was to take a break, really, from the violence and figure out what their next steps are going to be. I also think that at that point in time, back in those days, it took longer to get out, and so there was more ins and outs into shelter and leaving their relationship till they could finally make the break. Comparatively speaking, in 2010, the Women's Resource Center was serving 39 families for an average of 45 days. So you can see, and I think there's probably individuals on this call that have had that same experience. Individuals were trying to get out, they were staying longer, and for a variety of things, the increase in number of days was increasing. Also at that time, there was declining shelter resources. Different types of housing options were being looked at, and so funding was coming in through different streams. I think one of the really interesting things in terms of public housing and how public housing policy has changed through the years is it used to be that it was a right to have decent, affordable housing. And at that point in time, there was increasing housing stock. Of course, that has changed drastically, almost flipped to the other side of the continuum, and public housing policy now is about privilege and whether or not, and knowing that it's a privilege to receive decent, affordable housing versus a right. It was, although I have prior to COC, that's not necessarily accurate. In 1995, the Women's Resource Center was also involved in the first submission to HUD for funding. Civil legal remedies, I think, are also very relevant in terms of housing and economic relief. Back in the day, if you will, there was legal aid was the only option, and the laws did not necessarily allow for the economic relief that they are today. Welfare policy also across the country was very different. Incentives and assistance with education and the other types of things that women need to move beyond poverty and homelessness existed in a different way. And there was also general assistance available for individual women, which today general assistance is not being supplied to individuals. So for those individuals, obviously, that are survivors and are unable to work, it makes things more difficult. And oftentimes, those individuals may wind up on a chronic homeless list here. VAWA, again, was created in 1994, the federal law to address violence against women, and to once again bring us, as said from New Mexico, the policy as it relates to privacy, and pretty much making it clear that we cannot participate in HMIS. I also think it's really interesting that the current official poverty measurements were created back in the 60s. So that's a policy initiative or systems advocacy point that I think that we all could pay attention to maybe and work to change that to show more of a realistic gap in poverty. One of the things that I question and wonder about sometimes is back in the day, the use of rural safe houses, where community members used to open up their houses to women and children and families that were experiencing domestic violence, and also to pets and other types of animals, which, you know, that has pretty much disappeared for us. I don't know if it's happening anywhere else in the country, and I certainly would like to hear about it if it is, and how successful or not successful that option continues to be. It obviously engaged the community in a different way than some of the other work that we do. So currently, the Women's Resource Center about 5 years ago created an economic advocacy project and safe housing program. In 2017, we were serving 184 families using Housing First, and we do have an economic well-being focus. As you can see, in comparison to what was happening in 2010, we've almost tripled our ability to serve families. And of course, rapid rehousing and other types. I was not aware of the fact that rapid rehousing came about in Pennsylvania at such an early stage, and then we moved on to something else. So that was something I was educated on today. Again, public housing is now considered a privilege, and there's limitations in terms of access with criminal records and credit reports and those types of things. One of the positive things, though, is the collaboration that's going on between HUD and COCs and PHAs in terms of creating understandings around what some of those barriers are and trying to break through some of those barriers. Civil legal remedies have greatly increased, and I think that's a real high point and positive note in what is happening today. As there was a decline in legal aid funds, there was an increase in funding for DV expertise. In Pennsylvania in 2002, the Women's Resource Center was one of the first civil justice projects in the state, the Barbara J. Hart Justice Center, and they still exist and are able to do all types of civil relief actions as it relates to economic relief. Also, the state law has changed, so within protection orders, it's something now that the attorneys can pursue is economic relief. Of course, many of you know about the TANF policy. Welfare to Work has drastically changed, and there's no general assistance. VAWA has been funded to provide transitional housing and legal assistance to victims, which is a great positive. And the self-sufficiency standard I also find very interesting. So the most recent one I could find was 2010 for Pennsylvania, where a quarter of all the households and 2/3 of single mothers, head of households, lack sufficient income to meet their basic needs. I point that out because I think those types of statistics can be very helpful when domestic violence programs are trying to provide justification for funding for projects within COCs. So for the Women's Resource Center, Opportunity for Change came in 2012. We had little choice. We had a critical and sudden staff turnover and a significant reduction in safe housing funds. So as horrible as that was in the moment, it led us to great places. So currently we use hotels for emergency safe housing. And what that has created for us is doing an in-depth safe house assessment that includes safety risk, determining history of homelessness and violence, and also referrals that are available to those individuals coming before us. Housing First is certainly the model that we work from, but I would add a caveat to that, that I think with any domestic violence program, it's about safety first, and then right next to that is Housing First. But we shifted our focus and funding to, with housing, to rental assistance and other types of housing assistance. It created increased advocacy work to avert a crisis, if possible, with systems and with individuals. We increased economic advocacy and safety planning for leaving with the survivors that we were working with to try and avert the crisis, deal with the situation before the crisis. It increased offering of women meetings. We now currently offer weekly meetings on legal options, on economic and housing options. We also have pop-up groups. Currently there's one going on for survivors to address the trauma effects in relationships. And we also have dinner meetings once a month for those who are receiving longer rental assistance from us. They can come in once a month. We provide dinner and child care and a individual from the community to speak about a resource that exists in the community, and for the women that we're serving, for them to get to know those individuals. It also increased survivor autonomy, which I think is huge. It reduced our role as rule makers, and it opened up all types of opportunities as it relates to survivor agency. Options for safe house location for rural women in particularly became more open. Rural women used to have to travel to Scranton to use our in-house safe house or shelter. That's no longer needed. They can actually find crisis emergency safe housing within their own county. Also, I think important is that women can choose apartments that better meet their needs and their children's needs, whether it be for school districts or bus routes or, pet friendliness or other types of animals, culturally diverse communities that more meet the needs of the individual. I know in Scranton we have large populations of Hispanic Latina individuals and also Hasidic Jewish individuals, which they can then find housing within their communities, which is so important to be able to be within a community and find those types of supports. Okay, opportunity for change. So as a result of changing our model, it drastically reduced the number of turnaways for emergency safe housing. It's almost non-eventful. Turnaways are very few and far between, because at the very minimum we can provide at least one night. We became more evidence-based, which was a model that funders wanted to invest in. So an example is upward of 85% of the individuals that received comprehensive flexible services escaped and were able to stay out of the abusive relationship over time. I just would like to also say, though, that success is something that was defined by that 85%. That is not something that we impose as a success. I think success can come in many forms for survivors of domestic violence. But for this 85%, they defined it as success, and of course, funders like to see that type of data. We tripled the number of women and children being served, offering a continuum of housing options to meet the diverse needs of survivors of all types of populations. We've also increased our diversity within our staff to meet that need, and increased partnerships with community organizations and reduce silos. In Susquehanna County, our most rural county, they are a part of the Northern Tier Rehab, which is one of 2 PA balances of state COCs. Our Susquehanna County is one of 7 counties that's part of that Northern Tier. There is a huge geographical distance between the participating organizations in that COC. I think, currently WRC does not receive HUD funding through the Northern Tier COC, and we are working to change that and to become a funded project. Hopefully this is the year, knock on wood. But some of the drawbacks and barriers in that type of rural COC is somewhat obvious. The lack of face-to-face contact in doing long-distance meetings, it's harder to get to know individuals. We're a new member, so we're still trying to find our way through that. And I also think DV populations sometimes are not the priority populations, and so it's about advocating and finding ways to advance and provide understanding about what the needs are for the populations that we serve. Currently, the funding sources in Susquehanna County that provide housing is we provide housing through an Office of Violence Against Women Transitional Housing grant, and we also receive legal assistance to victim grant through the Office of Violence Against Women, which are great grants. We also use VOCA dollars and churches in rural communities, and I'm sure a lot of you listening would echo the same thing. In rural communities, churches are often one of the places that are providing resources and very much want to provide for charitable organizations, the United Way, and of course fundraising. So in Susquehanna County, some of the barriers in our work there is 12.9% of the population are at or below poverty level, and around 12% of the population are under the age of 65 have a disability. Transportation is a huge problem. We continue to try and problem solve around that in both counties. And as Jennifer was talking about, the natural gas drilling industry has affected the cost of rent and also has decreased the affordable housing stock in that county, which limited subsidized housing options for Section 8. And so that is also some of the systems work that we continue to do in Susquehanna County. In Lackawanna County, we have been a member of the COC since 1995, and it's a small COC with 6 other organizations. We know each other very well. The individual players within the projects know each other very well, and so I think obviously this makes a difference in how we work together. Our COC is a parallel coordinated entry system with no wrong door approach. Women's Resource Center is an exception to that. We do not do coordinated assessment per se, nor participate in the HMI system. I hear that other organizations, as in New Mexico, are using the VI-SPDAT. I understand it, but it's word of caution from where I sit. I see domestic violence, and I know that I'm preaching to the choir here, but domestic violence is a cultural problem. It's about gender violence. It's not necessarily about mental illness or drug abuse or other types of issues that survivors also experience. And I just think that we have to be careful in using tools like the VI-SPDAT to not allow for domestic violence to once again be defined in those terms. As it was in the past, domestic violence was being identified as a mental illness. Of course, we don't want to go back, and I'm not suggesting that anybody does, but I just think we need to pay attention to that. We are engaged in using an alternative database. We are in the midst of developing a system with ETO. ETO standing for Enterprise Nonprofit Software. We do trainings every year with our providers, with the COC projects using the HMIS system, and the trainings include assessment for domestic and sexual abuse and also for safety planning. Basically, individuals, survivors, or clients entering from any other organization, they have 3 choices. They can proceed through the coordinated assessment process. They can discontinue the process and proceed to us, to the Women's Resource Center, or they can do both. And clients always have the option within our COC of restricted data entry or being entered anonymously. I think it was Hank I heard say something about that. We want to continue to talk about that and to inform and almost make that a matter of practice, because I don't know that that necessarily is the practice, even though that option does exist. So this is what it says on our, with our COC's client consent to release of information for all those that are entering through coordinated assessment. It asks the question if you are safe, and then it specifically lets you know that you don't have to participate in entering the information. Oh, I see a typo there too. It's do not have to sign this form versus not. And then also if you're being abused, there's opportunity in that moment to be referred to the Women's Resource Center immediately. Looking to the future. So again, it's about creating a continuum of housing choices based on individual assessment and need as it's defined by the survivors that we're serving. Also looking to the future, we're looking to continue to get flexible funding. We know, and again, I'm sure a lot of you listening can also echo this, that if there's money available, let's say for a car repair or driving lessons or maybe a birth certificate to do a housing application, educational and training expenses for professional licensing or clothing or child care, there's, you know, the list goes on and on. To have those types of flexible options for flexible spending can help to prevent homelessness and or move survivors beyond poverty. Mobile services, I know that there's programs that are doing it across the country and are finding great success, and I think that's an area we have to continue to grow in. Pet care, the Women's Resource Center just started a pet care program, and it received a small amount of funding so that we can tend to the needs of pets, you know, because that is something that keeps survivors in abusive relationships. I think that's also challenging working with rural populations in terms of all the different types of animals that may need care in order for someone to escape the abuse. Expert legal services that address rural needs of domestic violence, that's ongoing. One of the areas is around natural gas, and attorneys being informed and educated about that so that when they go in on divorce matters and other types of property matters, they have what they need to have arguments. One of the things the Women's Resource Center is looking at doing most recently is trying to build a comprehensive education, housing, supportive service program, if you will. There is a university, Misericordia University, which is close to our program, that has developed a Women with Children's program. There's about 8 of them, to my understanding, in the country. I would love to hear from anybody else who has one close to them, where the university engages the survivor, provides housing on campus and all types of support services that will help them achieve success in getting a 4-year degree. Transportation we pretty much talked about. We all know how difficult that can be in rural areas, and again, I'm looking for any kind of innovative ideas around transportation for rural areas. Sustainable employment and working with employers, investing in work benefits that meet the needs of women with children. Again, I think this is the systems policy issue that we need to continue to look at. Locally, we have a group called Women in Philanthropy, or WIP. They're a great, brilliant group of women that are finding and implementing a variety of ways within our community to advance the economic well-being of women. Again, that is something you can find online if you want to look at that further. In the future, we have to continue to look at that intersection of poverty and domestic violence. We know poverty disproportionately affects people of race and other types of oppression. And of course, we want to make sure that we're paying attention to that as we create housing options and address the needs. Research and data. The Advisory Council, we just recently created an Advisory Council where we have 5 survivors, which I consider to be experts that have gone through our safe housing program. And they are providing us with feedback. They are talking to us about what we do well, what we could potentially do better at, and to continue to provide the service as survivors define it needs to be provided. One of the things that we were talking about at this last Advisory Council meeting is the development of a peer support model, similar, if you will, to maybe an AA model where new women coming into the housing program have access to survivors that have been through the program to be able to provide them with some level of mentorship. Again, if there's anybody out there that has seen that model or is using any kind of model like that, I would very much like to hear from you. And of course, the whole reason that we're on this call is about COCs and coordinated entry. WRC continues to seek and will work with the local COCs in Scranton and Susquehanna County to ensure that homeless population is being served. And of course, WRC is the voice of survivors and has been successful at providing justification for project funding, and we will continue to try and be that voice to provide that justification. That is all I have. Thank you.
Thank you, Carol and Jennifer. And I, should have known that with all this rich information that we had to present today, thanks to you all who came and helped with this webinar, we're almost out of time. And so I was just going to pick one question and would ask just maybe 1 or 2 of you to add any advice that you might have that you would offer to communities who are still figuring out how to bring domestic and sexual violence providers into the COC, like just one tip about the best place to start. Any of you want to take that?
Well, this is Hank, and I'll just say that the domestic violence programs that are most active in our continuum of care have applied for the rapid rehousing funds that are available through the continuum of care, and that seems to be a pretty good add-on service for the other services they provide. And so I would suggest that is a place people could look as a very concrete way to get a few domestic violence providers to be part of the continuum of care process.
And speaking from the provider experience perspective, I think what could be helpful around that is if like a counterpart to the Homeless Coalition or COCs reaching out to domestic violence coalitions or sexual assault coalitions to then encourage providers around the state because most programs might not even be aware of that kind of funding or might be thinking that for some reason it's not a good fit, if it's not, or other kinds of things like that. And so I think really partnering with DV and SA coalitions from a housing perspective to then maybe even speak at people's member meetings. I think it's really important for people to know that the Housing Coalition and their DV or SA coalition are strong partners and know each other and then disseminate the information from there. Because I think like from a provider perspective, that's how we would probably be able to kind of lift our head above the clouds for a second and think about any kind of change or taking anything on like that. And so I think the coalition level networking and relationship is the most key piece.
Thank you. Yes, and that's definitely been true. And oh, sure.
Go ahead. I was going to say, I'll just add really quickly that I think from the coalition standpoint, both for homeless and for DV, education to your member programs is key, and being very intentional about stressing the importance of collaborating.
Thank you. And on that note, we're going to have to wrap up for today. I'm so sorry we didn't have much time, as it turned out, for Q&A. We did get a question from one person for the Community Against Violence as to whether you might be available for conversations with other COCs about how they can work better with their domestic violence providers. So if you're willing to help with that kind of peer-to-peer learning, we would be really happy to hook you both up. And I hope that you all will be available to these folks as resources as you have today. We're so appreciative of your time today. And folks, we will be sending an evaluation at the close of this webinar. Through that, you can ask questions or request technical assistance. So please do indicate if there are other needs that you have that we might be able to either connect you with someone or provide those answers ourselves as the TA consortium. And here is just quick information about upcoming trainings. You'll be getting the slides, so I'm just going to talk through them so quickly. And here's how to contact us at the National Alliance for Safe Housing. Presenters, thank you so much. Just really rich, wonderful information, and thank you so much for sharing your wisdom. And thanks everyone for attending today.